Welcome to OAC Health Talks. I'm Joe Naglowski, President and CEO of the Obesity Action Coalition, and we are excited for you to join us for this educational series that dives deeper into specific health topics that we know are important to you and the OAC community. Health Talks are designed to empower you while providing straightforward, practical answers and insight from trusted experts. So let's dive into today's topic.
Hi there, my name is Dr. Emily Dhurandhar, and I am here today to explain everything you need to know about food noise. These are my disclosures, just so you can be aware of my affiliations. So you probably have heard about food noise in the media. A lot of people are talking about it, maybe in a patient forum, for example. And I think it's important to remember before we dive into thinking more about food noise that thinking about food is pretty normal, and it's also necessary for our survival. Food is one of our fundamental needs, and so, of course, we're going to be thinking about food sometimes. But I think what comes up when we're talking about food noise is, when does just thinking about food become food noise? In other words, when does it become problematic? So like most things that are being discussed in, patient forums and in the popular media, sometimes it's hard to know, is this just a fad or is this a real phenomenon? And of course, if this is something that you think that you might have or might suffer from, that's a question that you definitely want to know the answer to, right? Is what I'm experiencing real? And so because we saw so much about this in the media, being a clinician and a research scientist, we have decided to form a group of people to look at this question. And one of the places where we started was just how popular is this term, right? How much are people searching for it? So we went to Google and Google Trends, and you can see here that in April 2006, someone did Google food noise, and the Googles were pretty low. But around the time that Wegovy came out, you can see that there's a slow increase that becomes almost exponential as far as the number of searches for food noise on Google. And it's reached the highest it's ever been as of July of 2025 when we did this search. So it's definitely of interest, and people searching for the term doesn't, necessarily mean that it's a treatable construct or a harmful psychological phenomenon. And so Dr. David Allison and I got together and decided to partner to bring some science to this topic, and I'm excited to share that with you today. And Dr. Allison is the Chief of Nutrition and the Director of the Children's Nutrition Research Center, and he's at Baylor College of Medicine. And he is someone who is known for being a strong advocate for the idea that well-being, happiness, quality of life matters as a health outcome. He's trained as a psychologist. From my side, I've always been also interested in science that enables people with obesity to live better lives. And so we decided to partner on this. The other thing he and I have always done together is try to bring scientific rigor to a topic. What I mean by that is we try to make sure that the studies that we do are of the highest quality so that we can be confident that what we're finding is reflecting some scientifically established fact and truth, and so that can really advance medical science in the area. And so we are excited to bring some, both, I think, understanding that feelings and how people feel about their thoughts about food are important and worth studying. And then also we're excited to bring rigor to that topic and go about our experiments in a very thoughtful, careful way. These are other members of our team that have helped establish this area of research over the last year. And I couldn't find a picture of Rita at Baylor College of Medicine, but she was a primary analyst for this project. And Bernie also was a tremendous mentor to her throughout the analysis. And then we also have colleagues all the way from Denmark and Copenhagen to Yale, to George Mason University, Texas Tech University. And so we've brought together minds that are experienced with obesity as clinicians, and also minds who are very expert in measuring things like measuring psychometrics, measuring food noise. And Emily Ho actually is our psychometrics expert, and she's at Northwestern University. And so all of what I'm presenting to you today is a culmination of a panel that we held at the American Society of Nutrition meeting back in June of 2024. And so we've been working on this for a little over a year now. And I'm excited to share with you our process and what we've been up to. So at this panel, we first, of course, wanted to agree on a definition of what is food noise. And so to come to this particular definition that I'll now share with you, we actually reviewed all of the patient anecdotes that we could access in patient forums, like Reddit forums, for example, and the quotes that we pulled from multiple media articles, including Scientific American. Women's Health did a big feature on Oprah's special that I know some members of the OAC were also involved in. And we just collected all of those and looked for themes. And then based on those themes, we came up with a few defining characteristics of what is food noise. And so again, thinking back to when does just thinking about food become noisy or food noise? If you look at the definition of noise, that's actually a great place to start. And noise, according to the American Psychological Association Dictionary, is any unwanted sound, or more generally, any unwanted disturbance, like something like electric noise or, white noise in the background, right? And so the sound being unwanted, or in this case, the thoughts being unwanted, was certainly something that we saw as a theme when we reviewed the anecdotes that we pulled. The other aspect that we definitely noticed was people described food noise as persistent, inescapable, and also unproductive sometimes, in that it feels a bit futile, like you just keep thinking about it and you're not really enjoying that and it's going nowhere. So I like to think back to the movie Groundhog Day, which I'm hoping most people have seen at some point in their lives. And if you remember Phil, the main character in Groundhog Day, he relives the same day over and over, and he keeps encountering the same problems, and he keeps having that frustration, right? That sense of futility about dealing with this same problem over and over and over. And so in psychology, that idea of persistent and intrusive and unproductive thoughts is also described as rumination. And so that is a characteristic phenomenon of certain psychological constructs. And so another way to think about this is that food noise is rumination about food. And so you feel like you're just constantly thinking about food and it's rolling in your mind. It's mental chatter. It doesn't go away. You can't escape it. And not only that, but it's not productive. It doesn't result in anything that you want. And in fact, it might get in the way of some things that you want in life and some things you'd like to do. So here are some signs that you may have food noise based on this definition and based on the profiles of patients that we examined. So one consistent thing that most people say when they describe food noise is that the thoughts of food are frequent and intense and often to the point of distraction, to where it's hard to focus on other things in life that you might need to focus on. And then also the food thoughts can interfere with what you want to do in life. So I have many examples where a patient is trying to work and it's not necessarily a mealtime, but they're still running through the list of foods that they could eat later or might eat later, whether or not that's related to the what the food is, whether it's what they want to eat, maybe how many calories it is, whether it has the right amount of protein, whether or not it's going to satisfy this need versus this need, being like emotional need maybe versus health need, right? And so even when you're trying to get work done, you're instead finding yourself thinking about food as one example. Another sign that you may have food noise is that the thoughts are hard to control. And so a good marker of that is that even if you would like to stop thinking about food, you feel that you cannot. And it almost feels like, again, that's where that word intrusive comes from, right? It's intruding on your mind, and you're not able to control it or to hold it back. And so that's another aspect that many people say they experience. Another thing is that the food-related thoughts affect your overall well-being and your happiness, your quality of life. And so thinking that through a little bit more, that would mean that because you're thinking of food so often, it influences your mood, right? Maybe you feel frustrated, maybe you feel a little bit hopeless about, always having to think about food all the time. And it might also influence your actions in a way that you would prefer it not, where, maybe because you want to be done thinking about food, you eat, right, to get relief from that for a little while. That's one thing people experience. Or maybe because you are thinking of food, you are not able to do something else that you would much rather be doing, right, because you're spending so much time and effort on thinking of your food, planning your food. And so those thoughts become unpleasant and unwanted. They're affecting your quality of life. And then another characteristic of this is perhaps because of the pressures of society and the expectations of those around us when it comes to managing our food and our weight, it can be sometimes embarrassing for people if they're thinking about food all the time. And so if you're feeling ashamed of how much you think about food, or if you're feeling ashamed of not being able to control your thoughts about food, and some people even will try to hide that they think about food so much. So like if you're looking at your favorite food app and someone walks by, you might close it real quick because you're embarrassed that even though you're supposed to be doing something else, you're looking at DoorDash or something, right? So if you're hiding it, you're feeling embarrassed, then that's another sign that the food noise is perhaps unpleasant or unwanted, in part because you're worried about the judgment of others around you for having that food noise. All right, so is there a way to test for food noise? And as I mentioned, we have been developing a questionnaire to help measure food noise. And there's another group also, Corby Martin. They also put out a food noise questionnaire, a brief one. So there are now 2 available questionnaires to measure food noise. And the process of testing for a construct like this that might be clinically important is has a bit of a long tail, I should say. So we have developed the questionnaire, and we're at the point now where we're confident that it's reliable, meaning it does a good job every time, and that it's valid, meaning it's measuring what we think it's supposed to measure. So we've gone through that process, but we're still in the process of looking at how the questionnaires do in a clinical sample and how well they diagnose people with food noise, for example. And so I would say that, yes, there is a way to test for it, but as far as what the results mean, we're still researching that right now. And so there's no test you could take that says you for sure have very high food noise. We still have to establish that and study that a little more carefully before we can be really confident about saying that. But all of those studies are currently underway, we're excited to say, and so we should have those kinds of answers soon. Another thing that a lot of people want to know is does food noise influence your health? And I want to come back to this idea of a lot of times I think in obesity medicine, the history has been that we look at outcomes that are related to physical health. And it's only recently that we have started to look at outcomes related to mental health and to overall well-being and happiness in people living with obesity. And so food noise has been purported to actually affect well-being, and we did find that it's associated with certain aspects of quality of life. And patients also describe relief from food noise when they're taking weight loss medications, and we think that's one of the reasons this concept exploded when Wegovy came out, is because people noticed the difference in their well-being and their happiness when they were on these medications, and we're talking a lot about it. And they needed a name for the thing that they never realized they were suffering from before taking the medication. And so someone latched onto that idea of food noise, I think, and it just kind of grew from there. And so the fact that people find it relieving to take this medication is another telltale sign, right, that it probably actually does affect quality of life quite a bit. We've even had some patients say that they would take the new weight loss medications just for the sake of mental well-being, regardless of their effect on weight loss. And so I think that's a pretty powerful sign that it does impact quality of life and well-being. Food noise also is associated with dieting for weight loss, and Corby Martin's group demonstrated that more frequent dieting is associated with higher amounts of food noise. And so you can imagine, again, we need to do further studies to verify this, but the hypothesis right now, or our research question and our experience so far, is telling us that perhaps when people are dieting or trying to lose weight, that might aggravate food noise. And so if that's an unwanted or unpleasant effect of dieting to manage weight, then it's possible that that will impact your health in a kind of circular way, because it means that, you know, what you have to do to manage your weight and your health is difficult and unpleasant. And so that could, of course, impact your weight loss outcomes and therefore impact your physical health as well. And then future research will test if food noise is associated with weight loss outcomes and related health outcomes. And so, again, a lot of those studies are underway to understand, for example, is having high food noise a predictor of weight loss outcomes, of improvements in diabetes, of responses to certain medications and how well they work for some people. And so all of those studies are underway right now and will be ongoing in the next year or two. So if you feel that you may have food noise, I will say that right now there are no tested treatments for food noise. It's possible that cognitive behavioral therapy with an experienced psychologist or eating disorder dietitian or specialist could help, right, with food noise. And a lot of those concepts related to disordered eating could be very interrelated to this particular issue, and a lot of those techniques could help, but they haven't been tested, so we aren't for sure that they could help. But that's a good place to start if you're wanting some help right now with this. And the only thing I will say is that I am seeing a lot of things online that are saying this could help, this could be a solution for food noise, but I want to just caution you, because it's important that these things are tested, and we want to avoid, any false hope, and we want to avoid self-blame if the untested treatment doesn't turn out to be helpful. Sometimes that can fall back on you, right? Especially when you're having the lived experience of obesity, that can often happen, and we don't want that, right? And then also it can result in wasted time and wasted money as well. And so I would say that be cautious, and if something sounds too good to be true, it probably is. And please be confident that a lot of answers to the questions that we're investigating will result in future treatments. And so help is on the way. So just to recap what we went over today and a few takeaways to leave you with. So food noise is definitely a psychological construct, and it's more than everyday thoughts about food. And I would say scientists are just beginning to measure and to study food noise so that we can help better manage it. And food noise is persistent, unwanted, and unpleasant thoughts about food that can cause harm. So that's the definition that we're working with. And treatments are not yet tested, but research is underway. And with that, I would like to thank you for listening. And if you would like to learn more about food noise, you can feel free to reach out to me, Dr. Emily Dhurandhar. You can find me on LinkedIn, and I'm happy to connect you with any of my expert colleagues as well, if you would find that helpful. And thank you so much for listening today.
If you found today's Health Talk valuable, we invite you to help us continue providing trusted, science-based education about obesity and health. As we celebrate 20 years of education, advocacy, and support, your generosity helps ensure that we can reach even more people. Visit obesityaction.org/donate to contribute today. Your generosity fuels our mission. Thank you for making a difference.